I want to talk about is a whole systems approach to healthy weight that started in the northwest, northwest England, I should say. I've become very conscious of saying things like northwest and assuming that everybody says it's England. Now that I'm in Scotland, I realise there is another country there as well. But I'm talking about northwest England initially, and then work that's now spread into Yorkshire and Humberside and southwest England. So where did all that come from? And I should thank various people for slides. I have this habit of nicking slides all over the place, but I try and thank people where I can, so they're noted, and I make the assumption this presentation will go around, so feel free to come back to me on anything and you'll be able to see in more detail. So Food Active, as I said, was a northwest response. It was launched in 2013, and I was there involved with that at that time, to tackle increasing levels of obesity. And it's fair to say that there was, at that time, probably still is, but even more so at that time, quite a lot of frustration that things weren't happening nationally. And I think that's quite important. This was before any mention of, well, I think they'd been mentioned, but we didn't have a childhood obesity plan in place. And the whole idea of the Northwest response was focusing, as it says on the slide, on population level interventions. Less victim blaming, more environment framing, a quick, easy way of trying to describe it. And it's also worth, and a number of us have this kind of background. Sue, you said I've been many years in public health. I have, good grief, yeah. I try not to remember sometimes. But for a lot of us who have been in public health for a while, we've all been involved in tobacco control. And I think there is a lot of learning from tobacco control, both in policy development and an understanding of health inequalities, because as we all know even now, and I was living in Liverpool till last November, and I'm now living in Glasgow, the prevalence of smoking in the more disadvantaged populations is still considerable. We haven't solved that yet. We need to be aware there are considerable health inequalities associated with that, as there are in terms of obesity. So John actually mentioned some of his local figures and around the inequalities. So I'm not going to particularly take much time on this, and I'm rather hoping that everybody is rather familiar with this. But to make the point, it's a mildly complicated slide when you first look at it, but in the least deprived areas at reception, you have 5.7% of children overweight and 11.5 by the time they get to year 6, so it's doubled. Then you look at the other side, the other end of the graph, and you find that the figures are doubled again, and that's the key point. So it doubles from the least deprived to the most deprived, but it also doubles from reception to year 6. So there's a huge inequalities issue, and there's a huge issue full stop. I'll leave this, it's just to say it's getting worse, not getting better in terms of these disproportion. And not quite as clear-cut with adult obesity, but very much there as well. So, and as we know, deprived areas of poor access to healthy, nutritious food, energy-dense, nutrient-poor diets are often consumed in deprived areas. Areas of, I mean, we're talking before about local authorities and areas. I have local authorities in the northwest, who sort of northwest England, who queue up to say, oh, we've got the most takeaways. It's not an easy environment at all. So what we wanted to do in the northwest to see was the direct learning at a policy level from what happened in tobacco control. We were quite interested in the role of the local authority. John's been talking about all the different neighbourhood levels, and then a nice model out in terms of how people are involved in London. We were aware that within our areas in particular, a local authority has a key leadership role to play. And it's no good, as local authorities have had a habit of doing, is advocating or doing all these health education programs or doing what are often quite small-scale initiatives, which are quite worthy, but they're not actually looking in-house about what they can do. And we thought, let's have a look at what's happening in tobacco control. We looked at the local government declaration on tobacco control, and I have to say, of course, tobacco control is a lot easier in one sense than healthy weight, in that tobacco ain't good for you, whereas food actually is good for you. So yeah, it is more complicated, and we're aware of that. But what was the key about the local authority declarations, whether you're talking about tobacco or you're talking about healthy weight, is it's about strategic leadership. And that's something I want to reinforce in the next 5 minutes in terms of what the local authority declaration has done in the authorities we work with. We've had politicians who are standing accountability for the work going on in their local areas. They're publicly made we need to do something about obesity. We can't have this environment in our local communities. So there's strategic leadership, there's local awareness, and very much it helps to drive activity. And again, I'm not going to spend time talking about this. There are so many things around healthy weight that can be implemented at municipal level. There are some things, of course, we can't do. We can't suddenly have a different types of taxation, for instance, on different types of food. And there's some things we simply can't do at local level because we don't have the legislation in place yet. But there are a lot of things that can be done, and I think we're abrogating our responsibilities if we don't look at them. So some of those examples are up there. And they're not always easy. I mean, just to mention the last point there, local authorities should consider not accepting funding associated with industries produce food and drinks high in sugar, salt and saturated fat. That links very neatly with the PhD I'm doing at the moment, not about local authorities, about sport. Local authorities have got no money at the moment. We know that. It's a bit tempting, isn't it, if Coca-Cola comes along and offers you some money and says, could you put on some physical activity sessions? I would consider that deeply inappropriate, however. What kind of message? So there are big challenges in the kind of world that we currently live in with austerity policies that we have. So the Local Authority Declaration on Healthy Weight, all about supporting local government and its partners to take action. What can it do? And it requires officers and politicians to support these type of policies. Now, at the moment, and again mentioned in the paper today, because at the same time as we're here, it's the European Association for the Study of Obesity Conference, if I've managed to get the acronym right, EASO, E-A-S-O, which is ironically enough meeting in Glasgow at the moment. But what comes up every time is what's happening at, it says leaning from, I've only just noticed that typo and I love it, leaning from and sharing experiences with the city of Amsterdam. Amsterdam is always held up as the place where things are happening, and they've done some absolutely brilliant work, and we had the experience of helping the Dutch Embassy a little bit in terms of providing a speaker for the event that they had in January this year in London. And these slides, the next 2 or 3 slides, are taken direct from Amsterdam. To a certain extent, the kind of approach, again, is a little bit like John was talking about. What we're all talking about is looking at different levels. How can you target it? And they're having some success, and that's what's being talked about a lot. That's a detailed map of Amsterdam, so it's not right across the board, and it never will be. And it shows you that you perhaps need to look very much at your most disadvantaged areas. It's a multicultural city. There are a number of issues within that city, as we know. They've actually set a target, which I think is really interesting in Amsterdam, to have a healthy weight by 2033, i.e. a generation. That's what they think is absolutely required. But the key things about Amsterdam are no different from all the messages that the Local Authority Declaration on Healthy Weight has in the UK. Strong leadership, collaboration, what they call, which I rather like, moonshot thinking. So think ambitious. And a focus on equity all the way through. And it's that approach that has been used in northwestern England initially. And this is we're the first council to adopt a local authority declaration was Blackpool. And as ever, if you want to put a list down of the most disadvantaged local authorities in England, Blackpool would be right up there. And they took it on board because they wanted to adopt a whole systems approach. And on the left of that picture is the Director of Public Health, and next to him was the Cabinet member, I love this, for reducing health inequalities. That was her particular role at the time. And Blackpool signed up to a number of generic pledges, and a local authority declaration on healthy weight has 14 generic pledges, which you'd need to email me or look on our website, Food Active website, to get them all written down. But we also work with each individual local authority who signs up to have local pledges. That's an example of the work that Blackpool want to take on. There's nothing mind-blowing there. It's all stuff that you'd possibly expect. I mean, one of the interesting things about Blackpool actually is they still, out of their public health budget, provide free breakfast for their youngest children, which is quite a commitment. We looked at how it was going on in Blackpool about a year after they signed up. And these are some of the comments that came through. What I found really interesting was Councillor Graham Kane's comments overall, who's the Deputy Leader of Blackpool Council and still is, that as he puts it, the work in Blackpool comes under 2 headings as a council, see if I can remember this. One is economic regeneration, and one is resilient communities. And what often happens within local authorities is never the twain shall meet. So the economic regeneration bit say, oh great, we're getting a McDonald's down there, that's really going to help. And the other side of it going, oh I'm not entirely certain about that. Can we talk about it? And that's the general idea. We need to bring the two together. You can't have economic separate from health and well-being. And Blackpool have recognised that. And Graham speaks very well and very articulately about that. So within Blackpool, everybody sees obesity as an issue. Everyone feels they have a role to play. And the last quote there actually was somebody from a planning department who said there's a health and well-being golden thread to do with planning and placemaking when it comes to public health. The other thing that I wanted to focus on is very much people learning and sharing experiences. So when Leeds wanted to do the same thing, we had 2 speakers over from Blackpool to come and support them in the process. And that's a picture of colleagues from Blackpool, including Councillor Graham Kane, speaking at Leeds Civic Chambers. A little bit tight on time, so just very quickly you can see that here. These are different people within the council saying why a whole systems approach to healthy weight is critical. It isn't just about public health at all. In fact, probably in one sense that they have the least influence. They're in a role to lead and guide, but it's people in planning, it's people in education, it's people in transport that have much more to play in terms of healthy weight. And another series of quotes there as well. Somebody who is in fact a transport planner here. We need to know how different departments can influence obesity and make changes to their agendas, and all departments need to work together on agreed common actions. So we've had considerable amounts of success in the Northwest. This programme has been going for a number of years now, and we've now been asked to work in Yorkshire and Humber and the Southwest. And a slightly complicated slide, but what I wanted to illustrate with that is not only the number of councils that are being taken on board, and you'll see on the right, incidentally, Leeds and Kirklees, which is Huddersfield, if you don't know your Yorkshire geography, Huddersfield and the area around there. They've been the latest to join up. But Leeds has been in the press today in terms of it's supposedly the only city where childhood obesity is going down. Now, there is not going to be a single cause for that, I know that. But the fact that they've signed up to the declaration indicates to me they have a whole systems approach to addressing healthy weight, and that will be the key factor. No one will be able to disentangle exactly what's working. It'll be that they're taking that approach, and I think that's critical. But when we first started this programme, there wasn't a childhood obesity programme. We didn't have a sugar levy, and I'm delighted to see these things starting to happen at national level, because I'm a firm believer what happens on local and regional level also influences what happens nationally. I would think by the end of this calendar year we will have another 4 authorities, 5 authorities on the right-hand side there who've been signing up to the declaration. There's quite a variety of there, as you can see. I mean, I personally was delighted when Cumbria signed up because, believe you me, Cumbria County Council feels a little bit different from Liverpool City Council, but it shows the approach is exactly the same that's required. So, moving towards a conclusion, healthy weight declaration enables political leadership. Accountability raises the profile of obesity as a public health issue. Not really got the time, but this is what's happened in Leeds. Do have a look later. It takes a while to move towards a healthy weight declaration. This is not something that the leader of the council, the chief executive of the council, director of public health signs and sticks on a wall. This has gone through a lot of process, collaboration, discussion before it gets anywhere near that. So Leeds there talk about a process that went on for 18 months, quite a long, and they're still in the middle of it. We do provide material to support organisations who want to go down this path. Do either contact me or look on the Food Active website. We're moving forwards in that, having had a local authority declaration, we're having people from the NHS who would really like to do the same thing, and partners within local areas, as you'd expect, to be quite honest. So thank you very much for your time.